Let us welcome to the show a doctor from the northern part of New Zealand, Northland. Used to be called North Auckland, but I think we don't like that anymore. Northland doctor, comma, Dr. Gary Payinda joins us. Gary, good evening, sir.
Good evening, Pat. How's it going?
Yeah, it's going pretty well. I'm not entirely sure how I'm going to do this without Chewie. He's normally the brains, I'm normally the looks, but we'll see how this pans out. What I thought we could do, it's funny, we played this story off 3 News last night. TVNZ hasn't covered this at all, as far as I know. TV3's covered it, and in doing so, Stuff has covered it. And I saw the story just pop up on my algorithm from Stuff last night, and we only covered it kind of by chance, and it seems to be a really massive story. So I think the very first thing we'll do is we'll actually have a look at a section of the story from last night, which is what the Minister of Education first says. And then we'll have a chat about that. And then we'll go on to what David Seymour said today. So let's get into this. This is from the news last night. This is the Minister of Health. Did I say education? Something in my brain said I said education. Minister of Health, Simeon Brown, from last night.
The government expects Health New Zealand to be delivering timely, quality access to healthcare for all New Zealanders, not making submissions opposed to McDonald's stores up and down the country. We want them to be a health service, not the health police.
But doctors fear the government's latest edict is suppressing public health expertise. On Tuesday, medical officers of health were called to a meeting which they described as chilling. In a statement, National Public Health Service boss Dr Nick Chamberlain confirmed he told those doctors that they would need national level approval before making any public submissions.
To be making submissions opposed to McDonald's shops and getting involved in public policy matters is not their role, and we're being very clear about what their role should be and what their role shouldn't be.
Sir Colin Tukui Tonga, the former Director of Public Health, says he's never seen such an attack on public health advocacy before.
It's unheard of. Unheard of. I gave you perhaps an extreme example. It's like telling a surgeon, you can't operate on that patient, you have to operate on this. You have to trust people's professional judgment.
No medical officer of health would speak on the record to 3 News. In the past, these doctors have been able to speak freely with media and local councils about local health issues. At the moment, their team is facing a restructure. And with the latest warning from their boss and the health minister, they're worried about losing their jobs.
So that was half of the story from last night, mostly wanting to having a look at those things from Simeon Brown. I do want to get some specifics from you, like what doctors are we talking about, etc., etc. But first of all, just your response to that story last night.
Rising anger, and it makes my blood boil because these people, these politicians, are being completely disingenuous. They know perfectly well that the role of a public health doctor is exactly that. It's trying to prevent disease. So what a public health doctor does is try to intervene at a stage before the person has the disease. They look at things like alcohol, tobacco, unhealthy food, and they know that those 3 things account for 1/3 of all of New Zealand's health expenses.
Right.
And they're smart enough to know that if they deal directly with those 3 things in a preventative fashion, they can generate gains for community health, for the economy. Did you have any idea how cost-effective public health doctors are? So they're not like the rest of us. They are the best among us.
Right.
For every single dollar that is spent on public health, so on the work public health doctors do, the country generates roughly $14 in essentially in profit, in increased worker participation, increased productivity, decreased social services utilization, and decreased healthcare costs. These people, the public health service is a treasure. So people may not know what a public health doctor does. A lot of regular people might not have any idea, but you'll notice it when they're gone. So they're the ones who look after our clean water. So you've got 3 or 4 people that died in Havelock North due to Campylobacter poisoning.
Yep.
Fecal contamination in the groundwater. It's the public health service that looks after that sort of thing. Anti-smoking work, anti-alcohol work. When you go to an alcohol submission in your community where they're trying to open up yet another liquor selling venue, you will find a few stalwart community volunteers who've shown up on one side. You will hopefully find a medical officer of health who is a public health doctor, who, by the way, this is directly in confrontation and contradiction of what Simeon and Shane Retty and these others say. They have a legally defined role under health acts created by Parliament to do this work. They are specifically trained and have devoted their entire careers to looking after the preventative healthcare needs of communities. And so to vilify them as going off track or going rogue, to call them Muppets, which is what David Seymour said, Muppets that should be put back in their box, is a dishonorable, disrespectful, and absolutely disgusting comment from that man.
Hey, Gary, seeing you've brought that up, should we play? It's only 60 seconds. Let's play that
please.
now. In case
Please, because I need to take a breath. I have nothing but disgust for these people.
If you need to take your earpieces out so you don't hear Mr. Seymour, feel free. But we'll be 60 seconds. So this is what David Seymour said today.
I also just note there's been a lot of commentary today about Simeon Brown's directive to public health doctors. Frankly, I'm far from the only one cheering on Simeon putting these Muppets back in their box. We've had far too much hectoring and lecturing about our private health choices by people who are supposed to be focused on public health. And when a true communicable disease public health issue such as COVID came along, they weren't prepared. It is time to get public health focused on public health. That is things where one person's behaviour affects another, not trying to lecture McDonald's about whether they can open in Wanaka, which is really a private choice. If you don't want to go to McDonald's, that's fine, don't go to McDonald's. But public health is about communicable diseases and genuine problems where one person's choices affect another. If public health gets focused back on that, instead of hectoring and lecturing New Zealanders who have frankly had it up to here, then we're all going to be much better off.
There you go. 60 seconds of bile from Mr. Seymour today. Please continue, sir.
So some of what he said is absolute rubbish. He said something about we weren't prepared for COVID, right? Trying to blame that one on public health doctors. The world wasn't prepared for COVID. But you know who did prepare a comprehensive document for a respiratory pandemic in, I think it was 2017? It was the public health doctors. And it was an influenza preparedness document. They knew that sooner or later there'd be an epidemic, a pandemic of flu, and they prepared us for it in a way that a lot of the steps we took had been laid out in the work that they had done. And that work saved something like an estimated 20,000 New Zealanders. So this man is rewriting history. He's twisting things to suit his own political agenda. We know that. And he's ignoring the fact that these doctors have a legal mandate to fight against things that harm the health of the public. And as I said, a third of our health costs are from big tobacco, unhealthy food, including fast food corporations like McDonald's, and alcohol. And these are enormously profitable companies and corporations. And I really have to think that if he's not going to be on the side of public health and he's going to absolutely insult public health doctors, but you know, not just insult. So think of what Shane Reti did. He fired or disestablished 1 in every 4 public health workers. He destroyed the public health service. That's the kind of thing you can't recover from, not in terms of morale or manpower or anything. He decimated that service. And again, these are the people that look after our clean water, our clean air, drug and alcohol addictions, which they try to minimize the harm from, not to mention outbreaks. So in the next outbreak, be it measles or whatever, their work is going to be absolutely critical. And we have these, I don't even think they merit the term politicians. They are ideologues who are hell-bent on defunding, destabilizing, and privatizing our essential public services in New Zealand. That can mean the New Zealand Defence Force, police, right? They said there'd be 500 more police, and not only did they not deliver the 500, I think they're actually, the numbers dropped by like 72 or 74. Yeah. So we have less than what we started out with.
Yeah.
They want to defund, destabilize, and privatize schools, right? You know, the school voucher idea, where you hand taxpayer money to private corporations who will immediately siphon off some of that as profits, 10, 20 or more percent. That will be offshored. It'll go to investors, and not end up delivering services to New Zealanders. So in every realm of the public services, these guys are the jackals, like weakening the herd. And the herd is the New Zealand public, and the New Zealand public is cared for by the fire service, by the police, by public health doctors, by salaried doctors that work in the public sector, and teachers and others. And if you weaken them enough, you create openings and gaps and a distrust in the community of the service, to the point where the only solution that looks viable anymore is to introduce private corporations. And so the poster child for this is the school lunch thing, right? You had hundreds and hundreds of small businesses that were supplying food, caterers, that sort of thing, to local schools using fresh, locally grown items and produce, to great effect, right? Resounding success. And Mr. Seymour said that he wanted to destroy that program, but the public outcry was too great. People didn't like the sound of that. So he decided, when he couldn't destroy it in one fell swoop right at the beginning, he decided he would become the head of it and destroy it in pieces, right? You degenerate it, degrade it to the point where it's so bad that people are saying this is no longer viable, it's non-functional, and maybe we just need to can it. So at the end of the day, he's won. He has been able to win $85 million for a reprehensible multinational corporation, UK-based, Compass Foods, known for bribing UN officials, known for its Campylobacter and Listeria outbreaks in its food, a big provider of institutional food to prisons and schools internationally. And now they're here providing lunches to our kids, and reaping an $85 million a year. And of course, offshoring their profits. I'm not going to tolerate any of this anymore. And I'm going to speak out in every way I can, online, in person, if you see me at Pack and Save. And I'm going to say the same thing. There's only one direction that this country is headed in, under this group of arsonists. And it is towards a destabilized essential public service that is no longer functional. And then you will see the entry. So imagine Compass Foods and the school lunch program expanded to public hospitals, cancer specialists, public services of all kind. That is what is coming. And they've told us as much, right? Don't underestimate what Simeon Brown said. He intends to privatize and farm out to the private for-profit sector as much public surgery, as much elective services and procedures in the health system as he can get away with, as much as we will let him get away with. And once you do that, that money never comes back. Once you take taxpayer money, you defund the new operating theaters and new hospitals public hospitals that need to be built. You transfer that money into the private sector, right? We're talking about tens and hundreds of millions. And you allow them to build private theaters and hire your surgeons. Those surgeons leave the public sector, and the sector collapses in on itself. And that is what is going on right now. I want people to wake up and realize this is happening now. Realize that you can't wait 2 more years for the next round of whatever elections. Realize that marches and things don't impact these people where it matters. The only thing that Seymour and the rest of his neoliberal Atlas group, National, New Zealand First, the thing they respond to is power and money. And anything that the public is saying, like, what can we do about this? We agree that waiting times are blowing out. Things are getting worse than we've seen in EDs, and it's getting harder to see specialists. And I've got to wait a year for an MRI in the public system. We have to push back and affect these people where it actually matters to them, which is either in their ability to concentrate political power or their ability to concentrate money.
Lots of people in the chat, Gary, saying thanks for the cheery visit today. We're enjoying the lightheartedness of the conversation, but tongue in cheek, obviously. The seriousness that you're bringing to this, I don't think can be challenged anymore. We've said this for a long time. This neoliberal right, when they're in opposition, they'll point to the government being run by the left saying this doesn't work. They get in, then they start breaking government, and then they step back and they said, see, you told you it didn't work, and then they privatize. So this is an active maneuvering by these guys to be able to break government. We see it today with the Defence Force, 376 jobs to go, all civilians, all in the back room. So you're now going to have frontline staff doing those backroom jobs. Even the Defence Force, they're trying to break all of it. I was going to ask as well, you kind of answered it, because someone said last night, like the thing about a job, you have a job description. Like you sign a contract to have a job, and you've got your contract. In that contract for these doctors, what I hear you saying is it says they are to speak out. It says they are to educate. So therefore, would this kind of demand now by Simeon Brown need a legislative change? If this is the purview of these doctors to do now, how could they stop it? Like, how could they force them to start going from the top down before they spoke out?
So I'm no lawyer. I can't speak to the actual way the law will play out, but I can tell you, yes, it's in their contract that they have the training honed through years and years of work. Yes, they have the expertise. Yes, they have the dedication and the support of the other doctors in this. But it's not just in their contract that says they need to be respected as specialists and treated the same way you would treat any specialist or any expert, an engineer, anyone. Simeon Brown has no more right to exert his bullying over the public health doctors than he would to do the same to a water engineer or a civil engineer. Like he has no ability or right to do this. And yet he's doing it. There it is. I mean, this is very Trumpian stuff. And we have to push back. So we know that there are laws that go back literally decades giving public health doctors the power and authority to look after community health. And for specific examples, in the alcohol laws, they are required under law to provide commentary and input into new alcohol venues going up, right? More liquor stores in communities. They have a right and a mandate to be there that Simeon Brown or Shane Retty or Mr. Luxon or David Seymour cannot impinge on, though they would like to. These people are classic bullies. They will try to get away with as much shock and awe and as many insults and essentially as much clickbait, ragey stuff as they can get away with, until someone puts them in their place. Mm-hmm. And what we need now is a pushback from patients, from the public, from everyone. I was going to say from public health doctors, but this is chilling stuff, Pat. The public health doctors are scared for their jobs. 1 in 4 of public health workers' jobs have been fired, or they call it, like a euphemistic term, disestablished. These people have, mortgages, families, children to care for. They don't want to lose their job. And I mean, that's part of the reason why I do this. I'm at the latter half of my career, right? The later part of my career. I've worked on helicopters, done every kind of emergency medicine, literally around the world that you can think of. I do not have much to lose at this point. I only, in the time I have left, I want to do the right thing. And when the wrong thing is being done, I want to speak out against it. And so, for as long as people like you will have me, I'm going to take the bad news that this group of vandals creates every day almost, and I'm going to speak to it. And I can only talk about, my experience and my knowledge and my thoughts, but that's it. And of course, I always have to say that I'm speaking in a personal capacity. Sure. I'm not representing Te Whatu or the whatever College of Public Health or anything like that. I'm speaking in my own capacity as a doctor. And that's all I'll do. And that's all I will continue to do. And I won't stop doing it.
Just to clarify one more time, like when I think about doctors commenting on public issues, I think about people like Dr. Baker, Otago University. These doctors, the public health doctors, is this what they do 24/7? Are they about research and writing and speaking, or are they GPs that also do this, like their actual day-to-day roles?
Okay, so first of all, I don't think there's that many of them. I think the numbers are quite small. The last time I looked, it was something under 200. Okay. They can work in a lot of different capacities. They can work in academia, publishing things about, public health topics like alcohol harm minimization, that sort of thing. Some of them work as medical officers of health. So that might be the man or woman that I report a case of measles to, Gotcha. That might be the person I even need to call in the middle of the night to say, I think there's an outbreak. There's a cluster of cases. It's a problem and we need to get on it, whether that's foul water, dirty air, contamination, whatever. So that's a lot of what they do. Their job is to prevent disease, prevent illness. So that will cross into policy. It'll cross into environmental, like water quality issues. It will pass into the kinds of laws that are being made. And they have a specific legal requirement to be there in alcohol and tobacco and other forms of harm. When those things are being dealt with, they have to have a voice, because if they don't have a voice, the public is stuffed. Do you have a minute to tell me for me to tell you about an alcohol liquor license thing?
Do we have a minute, Gary? As long as you want. Go for it.
Okay.
Seriously, as long as you want. With no time limits.
I'll keep it short because I don't want to drone on endlessly. People have better things to do with their life than listen to me. But I had experience of being in a couple alcohol licensing. I don't know what the formal name for it is, but essentially there's like a hearing that happens in a community about whether liquor stores or bars or bottle shops or whatever, dairies, can sell liquor in another community. And like, of course, we know they target poor communities. Your average poor community may not have a dentist or a GP, but it will often have some place to buy liquor. And so they're incessantly trying to pop up more of these places because the profit margin on these corporations of harm, right? These big industries that really profit from human suffering and misery, they make a lot of money from this. And so when you go to the hearing, I went out of interest. There's a couple regular folks, just maybe a retired lady from the community in this case, one or two other people, parents that are interested, that don't want another place selling liquor that is on the school run, that is just going to become a source of problems in the community when there's already more than enough places to buy alcohol. The dates kept getting changed. And so the regular folks that wanted to turn up to voice their community participation, right, the democratic process, they have jobs and lives and people to take care of. And they could not keep accommodating the changes in the sort of legal dates that these hearings were taking place. I had to work one of those days, couldn't make it. The medical officer of health, part of their job was to be at this thing and to prepare for it. And so they show up saying, well, there's enough outlets around. There's a lot of harm. There's alcoholism. It's a vulnerable community. There's, public housing very close by. There's schools, all this stuff. They need to come up with reams of research. And this is just one public health doctor alone trying to do the best they can against 3 full-time paid lawyers. So there are firms that big alcohol contracts with, and they fly these lawyers around the country wherever these licensing bureaus hearings are happening, and they show up with unbelievable amounts of preparation, right? They've been doing this literally hundreds of times. They know how to appeal to the judge, to appeal to the public, to denigrate the public health doctor, to cast aspersions and make him or her look bad. So you've got a David and Goliath scenario. And after going to one of these, I was so unhappy, dejected, that I didn't want to go to more of them. You realize that communities are up against an almost insurmountable problem, and the only person standing on their side is the public health doctor.
Wow.
And I can't value them enough. They do good work.
Can I just pause for a second? Because I just want to now go back a step and go, and the Minister for Health is now telling that person that you're talking about not to do these submissions. That's not what their job is. So
he's telling them to mind their own business and keep their noses in immunizations, and in providing like dry technical data to things, but not in doing this. This stuff is part of their legally mandated role. So under the act, under various acts, the Alcohol Act and others.
So that doctor has to be there.
This is insanity.
That doctor has to be there in that meeting. That's that doctor's job. And well, when I say have to, that's their job. And Simeon saying, don't be there anymore. You're not to be there anymore.
Absolutely. They don't want them there.
Fuck, man.
They want big tobacco, big alcohol, McDonald's, all of that stuff to be able to railroad through whatever they need to with the least amount of obstruction, the least resistance possible. You've got to believe these people when they show you what they are, when they tell you what they're going to do. When Simeon Brown says he's going to try to privatize, to send out to the private sector as much of elective services, as much of elective health services, things like, your average surgery, he's going to try to send as much as he can of that, colonoscopies, hip surgeries, heart surgeries, to the private sector. That money is your taxpayer dollars getting diverted from building a new hospital, from building new operating theaters, from hiring surgeons, from retaining surgeons, from hiring nurses. They're diverting that into the private sector, private hospitals, which are going now like gangbusters. If you want a hot stock tip, invest in private hospitals. This government is enriching them and ensuring they're killing it. We have private imaging centers owned by multinational corporations popping up even in small towns like mine, because there are tens of millions of dollars coming their way, already underway and getting worse. We have people that are leaving the public sector to go work in private, following the money. So this is not accidental. This is completely intentional. He's told you what he is doing, and he is doing it. These people are executing a plan, and it's working very well. Hats off to them. They're not messing around. These aren't fools. For as much as people make fun of Prime Minister Luxon for his verbal gaffes and his inability to articulate and answer questions in an honest fashion, these people are expert at what they do. They're well supported, well funded. They have good corporate backing, and they are flooding the zone. They are putting more changes out there more rapidly than BHN. You could have 10 shows a day and you wouldn't be able to address the type of change that's happening in the country now. And I mean, I get to see it firsthand because I work in an emergency department that mostly serves underserved, underprivileged patients, just regular folks, working class people. And you can see they're doing it hard. You understand that when we take away free, it's not free, of course, it's taxpayer funded public medications. When we decide we're going to charge my patients to go get their prescription filled, in full knowledge that the money we raise from that is less than what it will cost us in increased hospitalizations. There's literally reams of international data, and I've put this all on my Substack, right? This is not a hobby for me. This is not fun for me. This is serious stuff, and I've tried to put evidence on Substack on these long articles that anyone can read. Just go read about it. You will understand there's international evidence that shows getting rid of the $5 prescription copay saves government and saves taxpayers money. There's many more people that get their antibiotics, that get their essential medicines, that don't end up septic and decompensated or in septic shock, needing an ED or an ICU. And yet they've gone ahead and done it. It was one of the first things they do. They are executing at an incredible pace. And I've got to give them some credit. I think it's pure evil. It's despicable, and it just supports corporate profits. But I have to respect it for its efficacy. They are moving fast.
What I hear you saying along the way is Maya Angelou's famous saying, when someone tells you who they are, believe them the first time. And that's what they're doing. Also, just for people who don't know, that flood the zone, it's a Steve Bannon concept, basically meaning if you put 6 ideas out there or 6 thoughts out there, the media might pick up on 1 or 2, but you get to drive the other 4 through because it's a gish gallop in real terms. That other stuff then gets missed. And you're right, like we do 3 stories a night, and this is we can't do more than this. We get people like you on to come and tell us more about it. And if we're going to talk about that, we should also just tell people Dr. Gary Payinda on Substack, go and check it out. I've got lots more questions, but I've kind of got one main one that's floating around from what you've said. And it's an opinion-based one, Gary, but you don't see backwards and coming forwards with opinions, because this is the government of business, so-called, so they say. That every dollar that gets spent on a public health doctor, they return $14. That is a brilliant return on investment. So that, of course, raises the question, why are they wanting to censor them?
No, Pat, you are repeating their talking point, they want you to believe they're a government of business. They are a government of corporate profits, pure and simple. If you want to know the thing that links all of the school lunches, emergency department waiting times, privatization, what they're doing to public health docs or teachers or you name it, you only have to follow the money. Ask yourself, who benefits from this? When you destabilize public health care, when you hire a man, Lester Levy, whose remarkable career was literally decades of creating private health corporations, New Zealand's, I think, first or largest private hospital, right? Which is now, I think, called Mercy Ascot. I think he was a founder. This man's business is to thrive off of the weakening and the destruction of the public healthcare system. The worse public healthcare does, the more business goes his way. Yeah. So I think he divested from most of these, maybe all of these at the last second. But when you put Mr. Private Healthcare in charge of the public healthcare system, all of the hospitals, the reimbursement to GPs, which is atrocious, nursing homes, all of that. When you make Mr. Privatization, Mr. Private Healthcare, the leader of that, what the heck do you think is going to happen? So no, they're not the government of business. They are the government of corporate protection and corporate profit maximization. They're the government of corporate profits. And again, just look at who's benefiting. Look at the private radiology centers that are doing tens of millions of business now because our departments, radiology departments, are withered and dying on the vine. They do not have enough radiologists. They are losing them to the private sector at a fantastic rate. Our hospitals, our rural one up here, Kaitaia, has been begging for a CT for a decade. They need one. The patient pathology up there, the patients need one. Can't get it. There's no money. Why is there no money, Pat? Why is there no money? Because the money's been spent on higher priorities elsewhere, right? Like $16 billion in tax cuts that mostly went to the wrong people, right? The sort of wealthier you are, the more of that taxpayer largesse you got. We're taking money from disabled people, cutting their benefits, and giving money to property investors. $2.9 billion could have hired every doctor and nurse this country needs. That $2.9 billion instead went to property investors. And I'm not talking, I've said this many times, not talking about the mom and pop who have one unit. You could always exempt them. You could always exempt the first house or the first and the second house, whatever, the first million. But they decided not to do that and to let it loose and to give taxpayer money to subsidize mortgage interest deductions for these folks. So this is not accidental. This is all part of a plan. It's really profitable and it's really, really good for some people. So if you are extremely wealthy, if you are in the top, 0.5%, you will make great money from this. But for the rest of New Zealand, it's the hollowing out of the public sector. It's the diminishing of the public sector and essential public services to a level that will not be recoverable for generations. So I talked to a public health doc today. He was so paranoid to talk to me. He had, thanked me for saying what I was saying. And he was really frightened to talk. He literally said, there's a huge amount of fear out there. People are really, really worried. And people are being forced to make compromises right now because they want to keep their job. The governing bodies that run public health are worried that they will lose their funding. So one of the things this person said, this public health worker said, was that these politicians in government now are punching down, knowing that none of us can say anything back. Right. So as long as these people are voiceless, I'm happy to speak for them. I mean, what's the worst that can happen to me? I get fired. if that's what has to happen, that's what has to happen.
There is
But-
there are obviously the chat's going pretty bananas at the moment. Lots of people, just so you know, Howie says, nurse here, big ups to Gary, thanks man. So there are people out there who are actively thanking you and me too for doing what you're doing. Lots of questions in there, but the theme that everyone's asking about is what can we do? Citizen says, how do we do this before they fuck us all over? Though we can vote, but it feels like it'll be too late by then. So the theme in there is what are we supposed to do, Gary? How do we, do something? Can we do something, or do we just have to hope and pray?
I think in some regards, some things are too late. We've left this not for the 11th hour, but the 11th hour and the 58th minute. Private equity has moved into New Zealand in a big way, not just in healthcare, but in other realms. And these are really the vulture capitalists, or the modern day version of the robber barons, who go into a public service with some assets, and they sell off and they sell off and they sell off, and they underhire and understaff. They wring everything they can out of it and then leave it for dead because they've got the money they needed. They've got what they came for, and realize these people will leave. Shane Reti will probably go be a chancellor of some med school that he helped fund, right, through National. Simeon will go do whatever it is people like him do. These people will find roles in marketing, in business, in corporates. If you look at the number of people that work for Philip Morris Tobacco and British American Tobacco among, I don't know, just family and friends and employees of the current government, it is remarkable. We've got gun and tobacco lobbyists, or supposedly ex-lobbyists, in positions of power right now, right, as ministers and stuff. So it is too late. We are being eaten alive and consumed from the inside out. Is there a solution? Yeah, I mean, things can get better, I have to believe, because I understand that things can get even worse. We can devolve into an American style winner takes all, two-tier, uneven, unequal system. And that's what these guys in government are pushing us towards. Like I mean, it's in many Western democracies. Western democracies are fragile. The public sector is almost undefended, right? Union participation is weak and meager and meek, and limited, and has been constrained by legal challenges and other things. So there's very little defense, and they're almost ripe for the picking. It's like it's like that jackal and the herd of gazelle. They're picking off the public sector right now. So what can we do? What I would say is do what you can. So Dunedin went out, and 30,000 people, like one of the largest public rallies ever, they said, hell no, this doesn't go. This is ridiculous. In my town, they've been rebuilding a hospital for like 20 years. For 20 years, they've said it's 7 years away. It's still another 7 years away. And they actually don't have any of the money set aside or dedicated to fund the last half of it. All the patient towers that are going to go up, which I think there's supposed to be 4 of them. This is where all the patients are going to be, the medicine wards, the surgical wards, all of that stuff. There's no money for that. There's no plan for that. There's no planning and design for that. There's nothing. It's going to happen in 2032, they assure us, but they can kick that can down the road endlessly. It might as well be a figment of our imaginations. They've got some steps of it going, a Whānau house, a pediatric outpatient wing, $30 million for this or that. But and they have promises of getting to work on an acute services wing of an ED and an ICU in the next few years to become open on 2032. But I just heard a presentation on the numbers, and what do you know? The numbers when that hospital opens will be too small to accommodate the need of what we have right now. So you could open that hospital, not in 2032, but today, and we could use those emergency rooms, those 55 patient spaces. Because I can tell you, there are times where the 32 beds in the ED are full, and there's 32 plus more patients out in the waiting room that we are trying to treat. So could we use that hospital right now? Yes, absolutely. But they haven't even planned for, let alone funded, the most significant phase, which is where all the patients are going to go, these patient towers. So yeah, it's a mess. What can we do? I don't know exactly, but I can tell you this: protest publicly, loudly, get out there. Do not make it easy for these politicians to get out of their car, to walk to their office, to have office hours at their office without sharing your opinion of what is going on. They need to actually have tangible, like it needs to have an impact on their lives for it to matter. And the only way you're going to do that is by affecting their ability to get power, to accrue power, or more importantly, money. So I'm keen to hear from anyone's suggestions on how you target those two things, but I do understand that is what motivates them. It is not about my poor patients going out and picketing around a hospital. They've asked, like, it can in community meetings, should we do that? Should we picket at the hospital? And I say, do what you think is right, what in your heart seems right. But your tears, your suffering does not motivate these politicians to change their course of action. They are not like you. They are not motivated by human suffering and sadness. They are there for a reason, and they are maximizing corporate profits with every single action they take. I want you to look in the energy sector, in supermarkets, in banks, in your mortgage, and tell me if there is even one realm in which things have gotten better for you as a taxpayer or a worker, or whether all of those fields have gotten better for corporates that are profiting. And you know the answer, Pat. It's windfall profits, record profits, historic profits for those sectors, and a decrease in the quality of life of my patients, of their ability to afford rent and to afford food and to afford medication and to get adequate and timely health care.
Gary, thanks so much for coming on. I appreciate you giving us the insights. I feel like we started this before we came on, and I said you can have as long as you want, and you made some kind of flippant joke about you being able to talk forever. Is there, before we wrap up, I just really want to give you an opportunity. Is there anything else that you want to tell the whānau watching right now about what's going on? Is there anything else we need to know now about what's going on around us now?
There's a message I want to get out to people like this person and another individual that wrote to me, who are scared about their jobs, their prospects for the future. They know people are leaving. They know people are worried about when they come out of training, whether they will have a productive and fruitful career ahead of them. And I want you to know that people support what you're doing. The work you do saves tens of thousands of people each year. You may not be able to just point to them and say, I treated that guy's heart attack, but you have made life better and made communities safer in New Zealand. And so to the public health doctors, you are the best of us.
If people want to find out more about you, your thoughts and stuff, there's a Substack, Dr. Gary Payinda, at Dr. Gary Payinda on Substack. Anywhere else people want to have I like your latest posting in there talking about us, open letter to the politicians telling them public health doctors to not talk to the public. Yeah. Anywhere else that people can come find you if they want to know more about you and more about what you're saying?
No, I think the Substack is an environment where people are not rabid. It's not all trolls, and it's a chance to actually learn some stuff and read some stuff. It requires a little bit of time, and these articles are not short, but I think it's a good option for people if they're interested. And just Gary Payinda, Payinda. Look it up on Substack, read. If you have different thoughts, let me know. It's a much healthier place than Twitter.
Yeah.
I still maintain some stuff on there, but that is a cesspit. And yeah, but I don't know, whatever. I don't care about the Substack. What I care about is that people hold these people accountable. Do not let them do bad things. Do not let them demean people who work hard, and confront them every time you can, every place you can, whether that's in the street, in the cafe, or at their office hours. Someone said, what should we do? Should we go out and bang pots at Shane Retty's office? And I say, absolutely, you should go bang pots at Shane Retty's office if you think that will make your voice get heard. And again, you've got to affect either their ability to get reelected, their ability to hoard power, or their ability to hoard wealth, either for themselves or for the corporate interests that they represent. And if you're not affecting one of those realms, then the work you do, while noble, probably won't have a lasting impact.
Gary, thanks for joining us.
You're welcome.
We'll have you
Good
on
luck.
whenever.
Thank you for doing this. I mean, like, this isn't stuff you're ever going to see in a 5-second soundbite. Like, I have these conversations with reporters sometimes.
Yeah.
And they're agreeing and listening and nodding, or sometimes disagreeing, but it's good, fruitful discussions. And 5 seconds of a soundbite comes out, and that is the world that we are creating. Again, it's corporate media, it's billionaire-owned media, right? We just heard that a new foreign billionaire has bought 10% of NZME, the controlling body corporation that controls the Herald. So pretty soon we can expect some crazy right-wing stuff coming down the pipe, sort of like the Fox News of New Zealand, and we'll have our own Rupert Murdoch. He's declared as much. What was the Maya Angelou quote you said? When someone
when people tell you who they are, believe them the first time.
Yep. So that's all happening, and hopefully all of us can understand where the pressure points need to be, where the pressure needs to be applied, where the levers need to go. And that's simply following the money and the corporate profits.
Yeah.
And the people who enable those corporate profits.
As sort of pithy as it may sound, when you're talking to those medical health doctors, behind the scenes in your own private time,
public health doctors,
yeah, sorry, that we're with them as well. I mean, I know that you're saying that some of them are scared, but we're with them. I know we probably can't do much to make them feel better at the moment, but when I see a 33-year-old bank teller telling public health doctors that they can't talk publicly about health, I'm like, yeah, we can see the shell game, and we'll keep calling out the shell game. That's what we can do here, and we're there for them as much as we can be.
Yep. That's a great message, and I know they're thankful to hear it, and they're doing good work every day, and long may it continue.
All right, Gary, we'll let you go. Thanks so much for joining us tonight. We'll talk again soon, eh?
Good night. See you, Pat. Thank you.
Dr. Gary Payinda on BHN.